I live in Jersey City, just outside of New York, and here it hit in a catastrophic way. Nursing homes really had refrigeration trucks outside for all the bodies. You had nurses, doctors working without any of the needed equipment, including having to use shower caps and ponchos and bandanas to cover themselves. I mean, there were just no provisions that existed even in U.S. storage. They had to take emergency supplies from China even while attacking China. So we were gathering this material, connecting with each other, trying to produce it and get it out to as many people as possible. And this became the basis of our book, Capitalism on a Ventilator: The Impact of COVID-19 in China and the US, where we made this comparison of what public health means, even in a country far less developed, without the wealth that the United States has, was able to do more for its population than here in the center of the US, in the most modern cities.
Capitalism on a Ventilator, a book co-edited by Li Xiuhin and Sarah Flounders, is an anthropological reflection from 36 writers from around the world, including Margaret Flowers. The book was written between March to July of 2020, when the full impact of the COVID pandemic hit the US and when people were actively asking questions and looking for answers. The book was published in September 2020, but Amazon quickly banned the book from their website within 2 weeks.
When the book came out, we initially tried to produce it through Amazon. They literally banned it. They wanted the title changed. Capitalism on a Ventilator wasn't suitable, and the content of the articles changed. We refused to do that, and we went ahead and published it ourselves.
We fought against the Amazon ban by filing appeal to their ban, but they are too arrogant to even talk to us seriously. We organized several press releases and webinars to denounce Amazon's ban on our book, but no US media, not even left progressive media, cover our story. 没办法，我们只能够是自己筹款，找商业的这种媒体公关公司帮我们在网上推广我们的书。其中有一家叫做 businesswire.com， 是美国最大的一个网络信息媒体推广的一个公关平台。但是当他看到我这个稿以后呢，不单止没有帮我们去推广，他立刻就把我的账号给封了，而且没有解释任何理由，知道吗？这个 Business Wire 老板呢，就是 Berkshire Hathaway 公司巴菲特拥有的。6 months passing, we thought there's no way we can beat the Amazon. Suddenly, in one day, we found China pick up our story on early March 2021. The China Daily and the Global Times. Both are English newspaper in China, very big one. Within 24 hours after the story was published in China, I found our book was reinstated into Amazon website. Yay! And we finally won. 通过这一次在中国有人报道我们这本书，从报纸到电视，我们甚至还有电视讲了我们的事情。我们终于有机会在中国有人知道我们出版了这本书，然后有中国出版社主动找我们翻译成中文版，在2022年初出版中文版。
Now, 2.5 years later, Amazon does carry the book because it's really now dated. It's dealing with older figures and a different time, and it's no longer the threat. But to them at that time, they were producing countless books with really scurrilous conspiracy theories, blame China theories, and ineffective treatments that all were at great expense. That's the kind of book they were interested in, not as political and social controversy over, not a contribution to public health.
On late November 2022, due to the pressure from social and economic sectors of the society against dynamic zero COVID, the Chinese government announced to scale back the strict health policy, begin optimizing precise COVID prevention and control measures, issued the 920 rules, the list of 20 new COVID health rules, and added another 10 new ones in early December. It dropped contact tracking, lockdown, makeshift hospitals, and mass testing, shifting the anti-pandemic responsibility from the government to the individual. From January the 8th, 2023, China further downgraded the COVID management from Class A to Class B, no longer considering it a health threat and lifting all international travel restrictions for foreign travelers. But China's Freedom Day didn't happen. Instead, massive outbreaks quickly occurred across the country. However, unlike Western world, China has a very strong social support network organized by the Communist Party of China from the top to the street level, including medical workers, volunteers, business, and neighborhood committees. They responded to the local residents' appeals, gave up holidays to work overtime taking care of patients, and coordinating medicines to reach the patients, working tirelessly and sacrificing everything for the people. Many of them have been infected and continue working despite their own fevers. While one can argue the timing and the wisdom of the Chinese government's decision, everyone should agree, for the past 3 years China has saved millions of lives and protected a quarter of world population from the COVID, and its economy has done better than the US, something historically unprecedented on the fight against deadly virus.